Doctors are helping newborns smile. Only 6 months old, and already he's undergoing his second surgery.
Curved, sharp scissors.
He was born with a cleft lip and palate.
When he was born, all I did was just cry and cry and cry. It was pretty devastating for me, probably because I didn't know enough about cleft, even though it's the 4th most common birth defect.
That's why within hours of birth, Dr. Rob Severinac saw Nicholas at the hospital.
It's not just the appearance that's important, it's also the speech, the eating, the psychological aspects, the dentition.
Doctors team up together to make these children smile. In the first week of life, orthodontist Baron Waitley takes an impression of the baby's mouth for surgery number 1.
Gets the Latham appliance placed, which is an orthopedic device that moves the palatal segments in alignment in preparation for my surgical repairs.
Every day, like twice a day, we would have to take a little screwdriver and actually get inside of his mouth, and there was a screw sticking out of his mouth. And we'd have to turn it either half a turn or a quarter turn. And that was real difficult, especially at the beginning, because it hurt him so bad. And it's kind of like a vice grip where you're turning it and it's just getting tighter and tighter.
It's a pain baby Catherine knows as well.
We're going to do a secondary lip procedure to close the lip and also to close the hard and soft palate. If you can see in there, it's still open.
Meanwhile, even feeding a baby with a cleft palate is tough.
I cried many times just trying to feed him so he could take a bottle. They have no suction, so they can't really suck. He vomited a lot. He just had a hard time swallowing. But like I said, you know, pretty soon you get used to it.
This is surgery number 2, where both a cleft lip and palate will be closed.
We really don't cut the bone at all. It's just basically elevating the tissues off the bone. So what we have here are the 2 palatal flaps raised.
After fixing the inside, Dr. Severinac moves to the outside and what he calls the fun part.
I say it's the fun part because it's the part that everybody sees, and it's the part that Nicholas will see the most.
And until now, parents had to drive cleft palate children to Riley Hospital in Indianapolis. Inside the clinic with baby Nicholas. That's Health Watch tonight.
Coming up later, we'll show you exactly what it means when a young couple takes the torch of the year 2000 Olympics.
But first, in my Health Watch report, part 2 inside Fort Wayne's only clinic to make newborns smile on News Channel 15. Babies born with cleft lip and palate. Last night, you first met Nicholas, who at 6 months old has already undergone 2 surgeries. Tonight, part 2 on helping a baby smile. 1 in 700 children are born with a cleft lip and palate. But this is how they look within 6 months, thanks to Fort Wayne's only cleft palate clinic. The looks change thanks to surgeries that Nicholas has already been through. Cleft palate affects how these children eat, speak, and hear.
Nico, where's the bunny? Where's the bunny? Nico, Nico. Look over here. Yeah, good boy. That's a good boy.
Research shows speech and hearing are important to development the first year. Ironically, to the sounds of opera music in the operating room. Dr. Rob Severinac is giving Nicholas his chance at normal speech.
I think it's very important to have the palate closed by 1 year of age so that when these sounds are learned by the child, they have a closed palate to learn them with. Otherwise, it's impossible to learn how to speak.
But surgeries aren't over after the first year. An oral surgeon will work to help nearly 20 years of surgery. Nicholas will be guided by a mother's love.
I only worry now as he gets a little bit older and into grade school that even though we don't see anything, that someone else will, and I hope they don't make fun of him.
And the love of his doctors.
That are kind of like my own kids. After I operate on them, they mine forever.